Hey, it's Chris with Road Dental Lab, and I'm here with T-Bone.
What's up, Chris?
How you doing,
What's
man?
up,
Good,
folks?
good
How
to
are
see
you?
ya.
Look, our number one goal is we're trying to help patients. As dentists, we want to help our patients. We want to grow our businesses, and what we do know is that the overdenture market is probably bigger than the fixed market. It's more economical, it's all of those things. So to me, overdenture is the beginning point to get into fixed full arch. And what we teach is our overdenture workflows is built around getting our patients started and giving them an option to get upgraded down the road into fixed arches.
Right.
Now, what we do is day one or Thursday is going to be live patient fixed surgery with a digital workflow. Day two, we do the overdenture surgery semi-free-handed so that we continue to build that skill set, because what we do know with fixed full arches is sometimes the bone quality isn't what we expect.
Right.
These are, oftentimes more sick patients that have lesser bone quality. So we do need to know how to freehand things, and that's where we introduce that skill set for people so they can do it. So yeah, they'll get scientific training for 3 days with hands-on exercises, then live patients on Thursday and Friday with live patients that they work on. And the other part is you bring your assistants get in there, they learn, they go back and they're ready to go, and our team members are here training them so that they can see, it's essentially exactly how we're doing it.
Yeah, no, that's great. And then another thing I see with these courses that are done, if it's overseas or across the board, wherever it is, you never know what happens to the patients restoratively. And here, the doctors can leave with a good conscience, knowing that they're taking care of all the way through their final that final night.
And honestly, one of the things I pride ourselves on is our after course support. You're not just here with me for a weekend or a week. You're here. I want you to be part of our family, and that's the atmosphere we try to create. So we have our community app, and then we'll post pictures of the patients when they're done. We'll post the X-rays when we get complications. We try to post those things so we can have that discussion, and for the most part, you can keep up with the patients with what's going on. And then yes, we do provide follow-up care, and we do provide final restoration for the patients.
Yeah, that's awesome.